Yeah.
Well, hello. As part of our divisional outreach, we thought it would be helpful to introduce friends of the division to some of our newest recruits. And one we'd like to spend some time with this morning is Ali Rabi. Ali is an R6. He's in his 6th year of residency here. He will start on the staff in January of 2022. That sounds incredible to talk about that year, but it's just around the corner. So Ali, perhaps you could tell us a little bit about yourself, how you got to this point in your career and what your career interests are.
Sure. My name is Ali Rabi, and thanks a lot, Dr. Sundt, for the opportunity to talk to you and to our friends this morning. I was born in Iran, and my parents are both doctors. I decided to migrate to Canada when I was young, and I spent most of my youth in Toronto. I went to University of Toronto for my undergrad, and I did an engineering and degree in University of Toronto. I studied engineering science with a special interest in electrical engineering. I then heard about this option of doing an MD PhD program. It didn't exist in Canada. You could get an MD separately and a PhD separately, but I heard that NIH had combined both of them in the US, so I decided to migrate down here in 2006. And I went to Johns Hopkins. I studied I did my MD degree and my PhD degree from 2006 to 2014 at Johns Hopkins. My PhD is in immunology and virology, and I came out of my PhD lab, went back to medical school, and immediately got interested in surgery, and particularly transplant surgery. And so I came to MGH in 2014 for my residency in the 4-3 program. And I remember working with some of our current surgeons as a second-year resident, and I got immediately in love with cardiac surgery and decided that this is the thing for me, in particular chest transplant surgery. What draws me to the field is both technical aspects and also opportunity to do research. I think cardiac surgery has a lot of untapped potential to understand how the body reacts with all of these machines that we are using, and be able to improve the care of our patients from that regard. It's really a field where there is a huge interface between machine and body and physiology. And I don't think if that interface is well understood or well tapped. I think that's going to be my interest. I'm going to study the effects of machines on the immune system. Currently, I'm interested in knowing how the machines, these machines that we are using for the care of our patients, are affecting the COVID, our immune system response to COVID. I'm looking at vaccinated people and also people who have had infection to COVID, and see if they maintain their protection against COVID after surgery. And we have some really fascinating results so far.
Yeah, some really intriguing data. Ali's had an interest in virology for a long time, and with the COVID upsurge of COVID, he really has done some exciting work. So we're looking forward to having Ali part of the division, and starting in 2022, and we're already figuring out how to support his laboratory efforts during that time. So thanks for your time and attention.
Thanks, Dr. Sundt. Thank you.